Good afternoon. Thank you for tuning in today to our webinar about boosting patient satisfaction with SecureMail. My name is Jeff McKay with Brightsquid. We're going to be going through a few things. We're going to talk about sort of the current situation with virtual care and what it will look like going into the future. We will get a patient perspective on satisfaction and with using SecureMail from an existing patient that we did an interview with this week, just to get some information for you from that side of things. We're going to do a demo as well to show you some of the workflows that do seem to have the greatest impact on patient satisfaction using virtual care and SecureMail based on some research that we'll talk about. With me today, I have Rohit Joshi, CEO and co-founder of Brightsquid. Rohit is he's a scientist and a lawyer who's been working in this industry for a couple decades, even though he's only 34 years old. He started early. Just want to point that out there. And so Rohit's been working with clinics and healthcare organizations across Canada, across the globe, really to help figure out virtual care and from a usability standpoint as well as a compliance standpoint. So it would be good to have Rohit's perspective on this. Mark Ayer has been working with clinics for about a decade, helping them implement virtual care in their clinics, talk about the compliance around it, but also the user issues. So Mark has dealt with thousands of clinics across North America, talking about how we implement things like SecureMail in their clinic and getting the workflows nailed down for them. So Mark will bring a lot of insight into that, and he'll sort of talk as we go through the slides, but also do the demonstration. Today, we're going to talk about, we'll look at virtual care in the future of healthcare, how it's going to fit in. I think we've all been sort of shocked into realizing that it has to play a part now that we've sort of been forced to adopt virtual care for a number of reasons. It's the value is starting to come through. So we'll talk about the health benefits. We'll talk about some of the research that's out there, and there's loads of it that shows the benefits to people's health through using this. We'll talk about how it changes patient satisfaction. As I mentioned, we'll hear from a patient who's using it. We'll look at the demonstration. There are winners in today's webinar, so that's going to be good. And we'll look at how you can get greater training on SecureMail. So it doesn't take much digging to look through the news and find out that that virtual care is kind of a thing now, how it's being adopted, and what it'll look like going forward. So organizations, colleges at a national level are saying that virtual care is really something that every practice should be looking at on an ongoing basis, not just a temporary solution through the pandemic, but it definitely does have a place in practice now in all areas of healthcare. And the way that we look at it is, how do we connect everybody to make sure that information is getting exchanged? Because information really is the currency in healthcare. You can't really have healthcare be provided without any information exchange. So we are here to help facilitate that. And I know that's why you're here too, to find out how you do that better. So let's look at some of the health benefits. And Rohit, do you want to talk about where this comes from, what this research points to in terms of the adoption of virtual care?
Certainly, Jeff. And maybe I'll start by saying, that there's been quite a challenge in terms of understanding why secure email. I think there's no challenge in terms of saying, why do we use email in order to communicate every day with our family and the business circles and with companies we buy things from. It's one of those killer apps that stood the test of a generation of usage. And you can't say that about a lot of technologies. The challenge with using regular email, though, is that it is not secure and private. And so if we're going to apply that technology in a medical environment, the first thing we have to ensure is that that technology has to be secure. It has to adhere to the laws that determine whether or not that information is considered private. And so in the use of secure email, we found that, third-party researchers found that there's a number of benefits for that patient. Everything from being more consistent in terms of the treatment adherence. When someone goes home, if they're able to communicate back with their provider, they can find that they're actually adhering to that treatment better rather than leaving the office and forgetting basically what they should do. There's been very specific examples on a study done where people with in depression recognized that by use of secure mail, the severity and amount of depression was significantly less. And finally, that all baseline measures tend to increase when the patients feel more attached to their providers. And so it gives a very convenient way of improving the health of your patients. And with improved health, we sort of always think back to a quadruple aim, better health, better for the provider as well. And so that's, it closes the loop with respect to the benefits that can be offered on a relatively small lift by the health provider. And I think that's critical. In this opportunity we've seen lots of video calls, lots of phone calls. The challenge with that environment is it's still one provider to one patient, and that consumes an amount of time that becomes a challenge in providing care to many, many people. So when we talk about secure email, what we talk about is a 1-minute email that changes the lives of that patient and in turn increases the satisfaction and the attachment of that patient to that provider. Next slide, Jeff.
Yeah, and I will add to that quickly. It also impacts provider satisfaction, as you mentioned, in the same way, right? Think of the level of impact that you're able to have when interactions are much more efficient or faster, right? And that'll kind of takes into some of these things. I know you're going to address it, Rod, so I'll leave it to you.
Yeah, and it can tell you there's a couple of advantages. So if we just look at the provider satisfaction and contribution, our results have shown, people using our product, that they can consistently manage a higher level of patient interactions. As a provider, sometimes we lose the point that, a quick message, which is, hope you're well, how are you doing? Remember that medication that we prescribed a week ago, how's that effect been? Even something as simple and as regular as that can lead to a very, very strong attachment between that health provider and the patient. Not to mention the fact that patients really believe that they need to have access to the clinic. Email is a part of every day now, and Jeff, you'll remind me, or Mark will here, what percentage of our users are over 60? Typically when we walk into a clinic, they're saying, I've got an elderly population in my practice, and therefore don't believe that email is an option, or a secure email rather. And the reality is that 95% of the patients believe that they should have email access. A 44% improvement of patient satisfaction, and it's regular and routine things like booking appointments, getting medication refills, clinical communications. And that's been so highlighted during the pandemic because it's been more difficult to just come in to the clinic. We're also finding that that 42% of the patients say they don't leave with information. And so the challenge, and as providers, when we meet with providers, they forget the fact that many patients, when they're in the office, have a sense of overwhelm. They don't remember their they don't remember their medication regimen. They don't remember what they needed to do. In fact, a high number, like 42% of patients. So one of the recommendations we have is if you can have a template that says for this type of patient, have the front desk send them a follow-up email with the instructions of what to do. That becomes very, very valuable for that patient because they can retain it, they can refer to it, and continue to be more adhere better to the treatment that they've been prescribed. Next slide, Jeff. And these are some of the numbers that we have gotten after a study that someone at one of our local universities did with the practices, and what they found was there are absolutely scenarios that are better handled by secure email. And so in this study, that there was, obtain results. They have a question that they want, or follow up on treatment. All of those were highly beneficial to use an asynchronous method of communication. And by asynchronous, what I mean is that you don't have to have a health provider sitting talking to that patient. That's synchronous communication. Now, the other part of this study, which we're not going to spend much time on, is there are absolutely those situations where a health provider needs to talk to a patient, and this is not taking away from that. So in the example where there is a serious medical concern, those are the ones that the provider needs to be taking. But in the absence of a product like this, all of a sudden that provider is not providing their best work either, because they're answering routine follow-up questions. And so the idea around secure mail is that it's an adjunct. It's taking away, I would say, lower value interactions like a question of medication or follow-up that can be made more routine and asynchronous. Next slide, Jeff. And you know what I'll do here is because Mark Eyre spends most of his time speaking with clinics and with patients on very much on a day-to-day level. Mark, why don't I turn it over to you, and maybe you can reflect the customer's voice here.
Yeah, sure thing, Rod. And to pick up on a couple things you mentioned a minute ago, regarding the demographics of Brightsquid secure mail users vis-a-vis their age, I think there's an overwhelming belief that people of a certain age don't enjoy using technology. In answer to your question earlier about how old our patients are, the average age of a patient using Brightsquid Secure Mail is 58.2 years old. So that means we have a lot of patients well into their 60s, 70s, even their 80s that are happily using Brightsquid Secure Mail to communicate with their doctors. The advantage that they're getting is they don't have to leave home. They don't have to travel. I can tell you within my own family, my mother-in-law and my father, it's hard for them to get out and get from place to place. And thinking specifically of my mother-in-law, she's quite content to use her iPad to communicate and get the information that she needs. So it's a lot different than I think the preconceived notions of elderly people when it comes to using technology like Brightsquid Secure Mail. It saves them a lot of time, saves them travel. Weather can be bad. I mean, we're in Calgary, and right now the weather is great. 6 months ago, nobody wanted to go anywhere. Even separate from the COVID-19 crisis that we're all currently experiencing. So, the ability to access your healthcare from the convenience of your armchair and your iPad in your warm, comfortable home is self-evident.
And I just think I'll just add to that, Mark, quickly. The idea of technology is being unfriendly or unfamiliar to a lot of people. I think it depends on the type of technology.
Mm-hmm.
I think something like email, we've taken great pains and steps to make sure that secure mail feels a lot like using an email account, which the majority of people nowadays, since it is a technology that's been around since the 1980s, most people feel comfortable using it. But when you introduce things like video and things, it gets more complicated. So a lot of times people are using email to sort of help filter those out and take care of the issues that can be done this way before we have to escalate to something that might be less comfortable.
Exactly. And then the last point on the slide right now with regard to the written record of a conversation, just, an anecdote from my own life. I'm a dad. I take my son to the doctor. I listen, try to pay attention, and then I get home and my wife says, "So what did the doctor tell you?" And I just blank out. I'm a dad and I can't remember.
Yeah.
So it's so helpful to be able to get a written record of, what was discussed exactly. What's the medication regimen? When should we come back for the next appointment? My son's currently going through orthodontic treatment right now, so I'm constantly taking him to the orthodontist, and I've got to remind him, to follow a certain regimen to, make sure that his braces have the intended effect. And so having all that, in something I can refer to days or weeks after the appointment is just so helpful.
Yeah. So in that sense, let's take a listen to a patient perspective on things, just to kind of quickly get a sense of how people are using it, and how it feels for a family using secure mail. And here we go. Paul, thanks for joining us today. I appreciate your time, and just want to talk a little bit about your secure mail usage with your clinic. I know you've been using for a few years. Can you talk to us a little bit about, how long have you been using it, and like which of your providers are you using it with?
Yeah, we've been using it for a number of years now. We've been using it with our family doctor for both my wife and our kids, as well as myself.
And without getting into too much detail about, patient information, like what sort of things are you using it for with the clinic?
It's kind of neat. It's actually just about everything, really. So anything from, I've got a question, I've got a pain in my leg or something, and we set up a call with the doctor. So being able to actually set up the calls with the doctor has been one way. And then because of COVID-19 recently, we've also had the doctor actually do a call with us, but based on the information that we provided in the communication over Brightsquid. So just general information like that, and then just questions about the kids. So the kids are they're growing. We're making sure that they're on the right trajectory. If there's any personal questions that we have with the kids that we want the doctor to give us information on, she's been really good about getting back to us. It's just about generally everything, really, Jeff. It isn't. We haven't found a limit. It's just like emailing your doctor.
How do you think it's changed the way you work with the clinic and your doctor?
I'm very much an email person and an IT guy, so I really do appreciate being able to send an email and not have to wait for a phone call back or have to talk to somebody in person. I can just send out the request saying, hey, it's been a year since my physical, for instance, or whatever the time frame is, rather, and I'd like to set up a time, and they get back to me with a few times. I can check my calendar and then reply back. So it's been really good. It doesn't feel as though on the spot you have to make a decision. You have to have all your information right there. It's easy enough to just send an email, get it back when you're available with the information. You can just reply, and then the convenience of you can reply at any time, in the evening, in the morning, middle of the night, and they can do the same. So it's good to wake up in the morning and there's an email notification that I can go check.
And have you looked in the directory for any other providers, like your dentist or anybody? Would you consider working with them through Secure Mail as well?
Oh, I totally would. I haven't looked in to see if they're in there, but if they are, yeah, that would definitely be much easier. It's a great product, so it's nice to have that. It was definitely, it just feels like you're more engaged and more connected to your doctor's office now, right? As opposed to before, you call in, you're on hold, you're waiting, and then they're getting back to you. You got to check voicemail, and I don't know about you, I don't like checking voicemail or taking calls. So it's nice to have email and just be able to have that. I generally feel like they're more accessible now. If there's any clarification, it's all in email. It's not like I have to sit there and have to explain it over the phone, or I lose my train of thought, or they say something to me and I got to reference it back and I can't because it was a phone call and I don't remember what they said. So at least I've got a record. I can go back to it and I can read it. Yeah. If I need more information, it's accessible. It's at my fingertips. It's nice. I'm really glad that you guys have this service out there.
Cool. So there we go. That's sort of the patient perspective on what it looks like to use it. We'll jump into the demo now because I want to make sure we have time for that. I will point out, if you have any questions, there is a question panel in the GoToWebinar panel. So Mark's going to take over things now and dig into a quick demonstration. And we'll try to address questions as we go through this. But anything else we'll hopefully get to at the end.
All right, thanks very much, Jeff. I went ahead and took over the screen broadcast just now, so everyone should be seeing my screen. And this is going to be a really quick demo. This is not intended to be a training session on Secure Mail. I just want to show a couple of example use cases, and then I'll talk about where you can get some real training if you're interested. So I'm going to log in here as a doctor. So rather than logging in as a staff member or as a patient, which I often do in demos, we're actually going to show the doctor's point of view, because it's important to note that incoming patient messages most often are handled by the staff, by the team within the organization. And when and where it's appropriate, those messages can be forwarded to a doctor for advice for being addressed by a medical professional. So in this example, we're logged into Dr. Pierre Fauchard's account, and he doesn't have a lot of messages, but you can see that today there have been 2 messages that have been sent to him by Clara. Now, Clara is his medical office administrator, his MOA, and we can see that she's forwarded 2 messages to him. So let's take a look here. First one, subject line is prescription is run out. And so here's a message that was originally sent in through the virtual front desk. So it was routed to the MOA team. And Clara has now forwarded this message on to Dr. Fauchard so he can see it within Secure Mail. So the message actually reads, my prescription for my medication is run out. I don't want to come into the office for any number of reasons, in this case, COVID-19. Can you send a renewal to my pharmacy, or can you renew my information? So Dr. Fauchard has a couple different options. If he wants to stay within Secure Mail, he can, of course, reply back to Clara and say, please tell Adam this information. He can even go so far as to reply directly back to the patient himself. So if I was to go that route, we'd actually use the forward function. And then when I'm forwarding the message, I would address it to Adam. He comes up in my autocomplete because he's a patient of record within our practice, and we could just send a message back to him. I won't actually type anything because it'll take too long and I'll make mistakes, but I can send information back to the patient directly. Now you'll notice, if you're sharp-eyed, down here at the bottom, I'm being told as the doctor that patients won't be able to reply back to me. And again, that's referencing the virtual front desk component of Secure Mail, where as a doctor or a clinician, I can send a message to a patient, but when the patient replies, that's going to be routed back to the front desk again. So in that way, as the clinician, I spend less time dealing with these kinds of messages, but of course, the ones that are brought to my attention by my staff, I can handle in the way that I see fit. Now, for what it's worth, I could also go ahead and attach the prescription, and I could just browse my computer and find whatever file that I might need. I'm just going to grab a sample PDF document because I have one here on hand, and I could attach that to the message. Now, I wouldn't normally send a prescription to the patient themselves, but let's go ahead and include the pharmacy. So I'll just grab the pharmacy. There's Cole Street Drugs, that's his pharmacy. And why not just send the prescription right from my own computer? This may not fit for every practice, but it's an opportunity that we certainly have available to us. So I'll send that now, and I can mark it as done in the EMR or whatever my workflow might be in my particular practice. Now, another example, also waiting here in my inbox, is another message from Clara. This one comes from Arnold, and Arnold's looking for some help because the prescription that he's on right now is causing him some stomach discomfort. In fact, he's actually vomiting, and he has a lot of questions about how to manage this. So what I might want to do as the doctor again is reply back to the patient and give him some advice. Drink more water, take it after a meal. I don't know, whatever the conversation might be, I can provide that either directly to the patient, or I can reply back to Clara with instructions and say, please give Mr. Smith this information. Oops, that's going to go to the front desk, of course. So all of that information, again, is handled through Secure Mail, and we can send all this information. Again, it can go into the EMR, but I'm just showing you some examples using Secure Mail just on its own. Now, just a quick note, when I sent that message a moment ago with the prescription information, I attached a PDF document. The Secure Mail service was founded based on the needs and requirements of radiology initially, way back in the day. And so as part of that, of those initial requirements, we designed Secure Mail to accept and manage all different kinds of files, especially those that might be really, really big. So, PDFs, JPEG images, X-rays, photos, Excel documents, those are the common things you see. But we also see things like video files and audio recordings and all those sorts of things. In fact, because Secure Mail is a web-based application and you can use it on your mobile phone or your tablet, you can actually use the camera or a recording device on your camera to take a photo, take a video, or whatever, and the patient, for example, could upload that directly to secure mail and send that message into their doctor. So the flexibility, I mean, I can and I have talked about this for hours on end, but given our limited time for today's webinar, I'm going to leave it at that for right now, and then I'll turn it back over to Jeff. But again, I want to thank everyone for taking time this morning to meet with us, and hopefully I've given you at least a couple more ideas about how secure mail can make life easier for you and your patients. Jeff?
Yeah, thanks, Mark. Thanks for bringing that to us again. I'm just going to go through quickly before we address any questions, and I appreciate you addressing some of the questions that have come through in your demo. So we have winners of the draw. We'll get to that really quickly because that's important. So most secure messages sent, that goes to Mihail SC. So congratulations, we'll be sending you a gift card. Most secure mail invites goes to Elias. So congratulations, thanks for inviting more people to the network and making sure that your communications are secure. And for showing up today for participation, Scott will get a certificate as well. So congratulations, everybody. Mark, you pointed out we do more in-depth training sessions. So here's how to do that. If you go to brightsquid.com, you hover over the secure mail item in the top navigation there. There's a drop-down menu, and you can just click on secure mail training. There's a number of dates you can choose. They're run at noon Mountain Time every Tuesday and Thursday. So you can go there, find a date in the next couple of weeks that works for you, sign up, and we go through in depth how to set up your account. Mark goes through in depth how to set up your account, different use cases, how to make sure that you're flowing messages properly through your virtual front desk, so that your staff or team are managing messages in and out, and you're making sure that patient messages are being managed appropriately.
And Jeff, I also want to add to that, sorry to interrupt, that you can also contact our customer service and support team 8 to 5, Monday to Friday. Of course, that's Calgary time where we're based. So if you can't attend a full training session, or even if you do and you still have questions, call, email, or live chat with us anytime. And you can reach us through that same link that you're pointing to right now. So sorry to interrupt.
Yep,
Jeff. Go ahead.
No, perfect. Thanks for that. I think that's very helpful. So we have a couple questions. We have a couple of minutes left. The first question that we have, and you addressed sort of different files that can be uploaded. So that was one that came through. So that was great. Basically anything that's not nefarious. So we will actually sniff out files that are dangerous, things like might have ransomware or other viruses in them, and not allow them onto the network. So when you're using secure mail that you're safe to access any files that are sent to you, as opposed to email. You want to be cautious about anything that you click on. But the question here, Mark, is how do clinics typically invite patients, or how do you get patients onto the system?
Yeah, so for most of our history, patients have been invited on to Brightsquid Secure Mail by their doctors or by their doctor's offices. I often say the doctor can do this, the doctor can do that as shorthand. But actually what I'm really saying is that, the doctor's staff, the MOAs, the staff members, the front desk folks can just compose a message. And the very first time you send a message to a patient, that's going to be their invitation as well. So it all comes in one bundle. So if, for example, if I was to invite, you right now, Jeff, I would just simply invite you from your regular old-fashioned email address. I would compose the secure message with attachments that I'm going to send to you. And when I send that invitation, you'll get an email notification that says Mark at XYZ clinic wants to invite you to Brightsquid Secure Mail. Click here to do so. And then the patient establishes their own account. And once the patient establishes their own account, they become somewhat of an autonomous user on the service. So they now have access within the Brightsquid Secure Mail service to communicate with the practice that invited them, but also their other practitioners in their area as well. And there's not enough time in today's conversation to go into all of that, but it really opens up doors to our patients to communicate with all of their medical providers, and the convenience is just exponential at that point.
Yeah, it is about folks sort of focusing patient-centered care. The other question, Mark, that we do get quite often, and this has come through here today again, what sort of volume do patients get? Are clinics able to easily manage the volume of messages they get from patients once they've onboarded their patients? And I will mention to you, we have the ability to help you invite all of your patients at once, sort of like a mass invite. If you don't want to do it individually, if you have those email addresses ready, then we can help with that too. But so what happens to a clinic once they've done that?
Well, it really varies depending on the size of your practice. But one thing that I will say is, as secure mail volume goes up, telephone conversations go down. And that simple axiom is what makes secure mail so valuable to our practices. I mean, you alluded to this, or maybe it was Road who mentioned, the staff satisfaction of using secure mail instead of having to make phone calls, leave voicemails, call a dozen times to get a hold of someone. When those headaches go away, secure mail just becomes the de facto better way to communicate, and it just makes everyone much much happier. So the
Yeah, I will
volume
add to
really
that.
varies, but so okay, go ahead, Jeff.
Yeah. No, I was going to say, I will add to that quickly because we're just out of time. But we have clinics that have actually attributed their use of secure mail to increased staff retention for that very reason, right? People are more satisfied with their job. They're not overwhelmed. They're able to manage the level of communication that they're handling and able to be more focused on their job. So that does have benefit there as well. That does bring us to our time today. Rohit, Mark, any other comments before we wrap up?
I know that there's probably more questions here that were asked that we haven't had a chance to finish, just so that we stay on time. But we will get back to you. There's a specific one around, can we capture symptoms and the narrative in terms of the secure email? And I would say think of it as any other web mail. So yes, absolutely you can. And we've got some integrations we can talk to you about if you reach out. Thanks everyone.
For sure. Thank you. Have a great day.